Good afternoon, and thank you for joining us for this important update on our response to the pandemic and our efforts to eliminate and eradicate this deadly virus. First, let me address something that is top of mind for many of us, and that is the events that occurred at the nation's capital last week and the alert issued for possible demonstrations that could occur in every state capital in the coming days. I want to assure our residents that we are monitoring the situation closely. The Denver Police Department is coordinating with state and federal authorities, and we're prepared to do what is necessary to protect lives and property during any possible demonstration. As we assess and reassess the information that comes in, we'll be implementing some precautionary measures for downtown city government buildings, including modified hours of operation next week, among others. We're still in the middle of a pandemic, and for your health and safety, we discourage anyone from gathering in large groups and risking a spike in the spread of this virus. And while we respect people's First Amendment right to peacefully assemble, we expect people to do so lawfully, which in Denver means you cannot open carry a weapon. And let me be clear, we will not tolerate violence, destruction of property, or risk of safety to our residents of any kind. Now for COVID. I want to begin by announcing that we have just received contingent approval from the state for Denver's inclusion in the 5-Star program. With that approval, Denver will open applications soon and begin pre-certifying businesses. However, it's important to remember that Denver must maintain 7 days of stable or declining orange level metrics as defined by CDPHE before the program can be fully implemented. The city will be notified by CDPHE when we meet the criteria to proceed with the program, and certified businesses are permitted to operate at reduced restrictions. Next, as you're most likely aware, and Bob McDonald, our public health director, will be covering this in a moment, we're starting to see fluctuation in our average case rates and other metrics, which we expected following the recent holidays. Even with people starting to receive the vaccine, and Colorado is doing much better at it than most states, we're looking at almost 5% of Colorado vaccinated right now. That means over 95% have yet to receive a single shot. I say this to remind all of us that vaccines for a few of us does not mean immunity for the rest of us. We've got to keep wearing our mask, social distancing, and sanitizing because we have a long way to go still, even though we're getting closer and closer to the end every day. We see all the hard work by our residents, and we want them to know we appreciate it, and we ask them to keep it up. Now, yesterday, we heard the governor lay out the current challenges with the vaccine supply and vaccine distribution. Unfortunately, these challenges aren't unique to our community or our state. While the federal government this week adjusted vaccine eligibility for 70 plus to 65 plus to help speed up delivery, I just want to caution you that it could take longer to get the vaccine than you might had hoped as we started this process. We need to be patient just a little bit longer. I certainly join the governor as well as everyone in waiting to get their shot, who is waiting to get their shot, the frustration we all feel. And I want to acknowledge that it can be confusing for some folks. Throughout the pandemic, we've been in frequent communication with the governor and his team. That continues with the state's vaccination planning and rollout. And we will continue to support the state's plan as much as we are able so these vaccines get to the people who need them the most, who need it the most, as quickly as possible. Now, in the coming weeks, you will see mass vaccine events in and around our city. And while these are not city-run events, we will support these efforts as best we can. We also have our own unique needs as a diverse urban center of our great state. I've communicated some of these unique needs to the governor. I've also joined with a group of mayors from cities from across the country who will be asking President-elect Biden, once he's in office, to provide cities with greater control and greater flexibility in obtaining vaccine supply and directing distribution, especially to underserved populations and people who don't have access to a large healthcare system. I want to underscore this move. This is being done by dozens of major cities across this country who recognize that if we truly want to achieve the goal of the number of people vaccinated in this country and the time that we need and want our people to be vaccinated, we're going to have to work more closely with the states to distribute the vaccine. And so I was proud to stand with these mayors from major cities across this country and say to President-elect Biden, we want to join with you in your goal to vaccinate 100 million people in 100 days. And we can help do that by our ability to be closer to the people and to help distribute the vaccine in a more efficient manner. Now, I'm talking specifically about our neighbors experiencing homelessness, for example, and our communities of color already disproportionately impacted by this deadly pandemic. This isn't meant to circumvent the state's plan. If so, we can address our local needs and stand in the gap to support the broader statewide efforts, just as we have done throughout this pandemic, ensuring that anyone who wants the vaccine has access to one. Now, in the meantime, we will continue to plan for when there will be the greater distribution supply of the approved vaccines. And Bob is going to have more on some of the efforts we're getting ready to stand up to support local community vaccination. Again, we're getting close, but we're not quite there yet. So please keep wearing your mask, keep social distancing, and keep avoiding large gatherings and large groups. And let's keep our guard up until the full cavalry of the vaccine has arrived. With that, I'm going to turn it over to Bob McDonald.
Thank you, Mayor. Good afternoon, everyone. I'm going to share some slides here to kind of navigate through our conversation and do some level setting about where we are. You can see here that I want to start out where I normally start out, and that is with what does the national landscape look like? And you can see that as a nation, we are still struggling with controlling this pandemic. There have been states that have had hospitals that have had to tap out, where they have not been able to accept any more patients. And just weeks ago, Denver was heading in that direction. You can see now we are no longer categorized as being in severe outbreak, but it will not take much to get back to that point. So we need to move forward with some real caution, whether it be operating in the orange level or with certifications or what have you. We also have some priorities we need to think about, not just small businesses, but getting school back into session. And so a great deal of reason for a lot of caution still. A little closer to home here, you can see that many counties throughout the state are still have very high cumulative case rates, in some cases well above 350, which would be in the red phase of the dial. Denver, you can see, is also in that category, although we are authorized to operate under orange level restrictions. We are still operating with red level metrics within the state style system. And when you look at Denver's epi curve, you can see that we've had a very high peak here, running the risk of compromising our hospital systems. And when we moved into red level restrictions, our numbers came way down. And you can see here at the tail end of the epi curve, numbers are starting to tick back up again. We're about 2 weeks out now from January 1st and the holiday season. So we'll have to see over the next week or so what direction do our metrics go. Hopefully these numbers trend back down. You'll see at the end of this tail here, it looks like it's tailing off again, but you have to dismiss that the last day or two because of delayed reporting. Regarding the 5-star program, I can talk a little bit about that later and answer any questions you might have. We need to be under this line right here for at least 1 week. So we're trending in the wrong direction. Hopefully we get back down under 350 for at least a week. And then those pre-certified businesses can start to operate in a less restrictive level. Back to the state style here, just as a reminder, we look at 3 primary metrics: cumulative case rates, which is still extremely high. Positivity rate's been stable. I looked this morning, it dropped a little bit to 6.9%, and stable hospital days actually ticked up to 10 days, which is good news. But all of these metrics are still very, very vulnerable with the state that we're in right now. Talk a little bit about the vaccine. You can take a look at just a reminder here that we have 2 primary vaccines that are very, very effective. Both require 2 doses. And as you read through this information here, I want to take a moment just to stress a couple of things. And I think the thing I want to stress the most in my update is this: there is no way that we are getting out of this pandemic unless a high percentage of our population gets vaccinated. There's absolutely no way in getting back to some sense of normalcy, getting back to the lives that we enjoyed before the pandemic, unless a large percentage of the population gets vaccinated. And remember, right now, one vaccine is approved for those that are 16 years of age or older. So children cannot get vaccinated yet. All the more reason for those that are eligible to get this vaccine. Tens of thousands of people were vaccinated during the trial period, over 1 million people in this country and millions across the world. And still we see very, very minimal symptoms that stem from being vaccinated. There is soreness in the arm, much like you might see with other types of vaccine. And after the second dose, there are reports of fatigue and some low-grade fever, but generally short-term. And that actually means that it's working. When we experience those symptoms after we are vaccinated, that's the body's response to developing immunity to the real thing, to the real virus. That means that it's working. So we'll talk more about the tiers and who's eligible and how we start ramping up doses becoming more available and get more people vaccinated. You can see, and I know Dr. Judy Schley with Denver Public Health will go into a little bit more data here. You can see we've been off to a bit of a slow start. I'm very confident here that numbers will start to tick up much more quickly as we roll out our vaccine plan for the city of Denver. You can see right now about 3.5% or so in Denver received the first dose, tracking pretty closely, slightly higher than Colorado and slightly higher than the US. And again, we'll talk about our vaccine plan and how we expect those numbers to tick up much quicker than they have been over the last couple of weeks. Denver is, all local public health departments and municipalities are subject to the state's tiered system. And so you can see that here, we are still in this phase, this first phase here, wrapping up the vaccination of highest risk healthcare workers. Now, those some in the age group of 70 or plus are now starting to be vaccinated. Again, that's been a bit of a slow response. I've gotten a lot of questions about where can we go, where can we sign up to get the vaccine, and so I'm going to talk about that in a little bit. But I expect that we will be in this phase here for a number of months here, and then in the spring and summer, you can see we'll roll out into phase 2 and phase 3, and we're working on the plans for those right now. Denver's plan is going to largely rely on existing infrastructure. We think that's the best way to operate. And as we build out our vaccine plan, I look back on the state's, the city's testing process. And just as a reminder, the city had opened up the Pepsi Center and thousands of people were tested, sometimes 2,000 a day. And so the Pepsi Center stood in that gap, but we knew with that model that we were not reaching out to our most vulnerable communities. We stood down the Pepsi Center and we stood up testing sites embedded into communities, our most vulnerable communities. And as a result of that, we are seeing a much greater rate of success with getting our most vulnerable populations tested. We want to move forward with that same model. Embedding clinics, clinical settings, and pharmacy settings where people have greatest access to that. And I'm happy to report that in the last couple of days, we've added over 20 more pharmacies. So we have well over 20 pharmacies now that are authorized to accept vaccine and administer it. That, coupled with hospital systems and clinical settings, we will have dozens and dozens of locations. It'll be the focus of this department and certainly the city to fill in the gaps. We will be posting on our website in the very near future a mapping of where all locations are, whether it be a hospital or a clinic setting or a pharmacy. And we'll look at that mapping. You can all look at that mapping to see where the most convenient location is for you. And then we will be focusing on those locations that may not have access to close pharmacies or clinics or hospitals. So more to come on that. I would expect in the upcoming weeks, we will have that built out and have that information readily available for those that like to see where they can go to get vaccinated. we need to stay the course here. I will share just a personal note here about how effective face coverings can be. Just a couple of weeks ago, I was contacted by a friend that I had spent some time with over coffee, just talking as friends do. We had spent well over an hour together. I kept my face covering on until I wanted to take a drink of my coffee. Well over an hour we spent together. The next day, he decided to go and get tested, and he had tested positive. To this day, I've not been tested positive with COVID-19, haven't experienced any symptoms, and yet I spent close to 90 minutes with someone that was very likely infectious at that time. But I was diligent in wearing my face coverings. So we are many, many months down the road here before we reach that point of herd immunity. Until we get there, we can control our numbers, get schools back open, protect our businesses by wearing face coverings, distancing, and hand washing. And with that, I will turn it over to my colleague, Dr. Judy Schley at Denver Public Health.
Thank you, Bob. It's very nice to be here and to join the mayor and Bob and this presentation. So I wanted to give a breakdown of what's been going on at Denver Health in terms of vaccinations and a snapshot of what we've been doing. Just first off, we have both Pfizer vaccine and Moderna vaccine, and we've received about a little over 8,700 Pfizer vaccines and about 11,500 Moderna vaccines. And those are including both our vaccines that are for first and second doses. We're following the state guidelines. We're focusing on our first responders, our healthcare workers, and our people who are 70 plus as the patients who are right now established with us. We at Denver Health, which is a safety net institution and hospital system for the city, are working to figure out a way where we can actually provide vaccine for people who are not affiliated with the hospital system. And that's a process that we're working on very quickly. And so with the city to make that a reality so that people can come and get vaccinated. In terms of who's been vaccinated so far, and we've been working with our city partners in safety to make sure that our first responders are vaccinated as well as community partners. Besides healthcare personnel and people who are 70 plus, we have vaccinated today, as of 11 o'clock this morning, over 5,000 healthcare personnel in our organization, of which almost 2,000 have had their second dose. We've had a little over 1,950 first responders that have been vaccinated through public safety, 250 community partners, and over 1,000 people who are 70 plus that have been a part of it. And if you want to see more details about what the vaccination coverage rate for Denver County, you can go to the Denver Public Health website under the COVID vaccine site, the COVID site, and you can see now a whole link on vaccine information, which includes maps on where the people live who are vaccinated, both in general for first dose, second dose, as well as by those who are 70 plus, as well as all the other age groups. In terms of what we're experiencing and how things are going, so I would call this vaccine liquid gold. We don't want to waste a dose. We want to make sure it's secure from the process, from the moment it's given to us to the moment it's given to a person. And so that's been happening, and we have a good process in there. We are able to pull an extra dose out of both the Moderna and the Pfizer vaccine, so that's been wonderful to allow us to have increased capacity there, and that's been helpful. In terms of some other things that I want to highlight is we're really proud of our ability to have worked with the city for our first responders, our community partners, our 70 plus, to be able to, as well as our healthcare workers, of course, we care about, and we've been working very hard with COVID for the past 10 months, to really vaccinate as many people as possible in a very short period of time. We still are having, to build it up, and we're vaccinating hundreds of people every day. We're vaccinating in 3 of our community sites, as well as in the hospital for our employees that are healthcare workers. The issues for us to really scale is, of course, everything that Bob talked about. We have to have more vaccine, and we don't have enough yet. It's We're trying to build that infrastructure to have more through this federal government to us at the city. And then also staffing, we want qualified people who know what they're doing to give a vaccine to people, because that's quite important. The other things that I want to say is that this is going to take us time. And so we really do need people to maintain some patience because the vaccine will come to them at some point, but it's not right away. And I'm so excited that so many people want the vaccine, but we have to be patient because we can only do so many people at a time. And I know Bob went through some of the safety information, so I think that's very important. And to remember that these two vaccines that we're using, both Moderna and Pfizer, were evaluated through the FDA, through emergency use authorization, and the Advisory Committee for Immunization Practices. They are considered safe and efficacious, particularly getting the 2-dose series. And so with the Pfizer, it's 21 days after the first dose, you get the second one, around 3 weeks, and then the 28 days for the Moderna, so 4 weeks. And we try to be as close as we can in that time period. And then after about 2 weeks after the second dose, we can say that somebody has about a 95% efficacy of being protected from COVID. It doesn't mean people are completely covered. Vaccines are not necessarily 100%. And so as the mayor said, and as Bob said, we must continue to all maintain our abilities of masking, physical distancing, hand washing, because we don't have enough vaccine in our community yet to be able to really ensure that everybody is safe. And the last piece I know is that people I know are a little nervous about getting a shot. It's like a flu shot. It's a little bit of a prick, and I've had my first dose and my arm hurt a little bit, and I thought that was good. You don't take ibuprofen or Tylenol before you get the vaccine. You take it afterwards, and then it helps with some of the side effects, which I do think is the body's immune response reacting to the vaccine, and it's a good thing. So with that, I'm going to turn it back over to the mayor and Bob and answer any questions. Thank you very much.
Thank you, Dr. Schley, so much for joining us for this. And we'll go ahead and start with Mayor Hancock. Any final comments, Mayor, before we open it up to questions?
No, let's go ahead and go to question and answer, Teresa.
Great. And I would just ask, we'll make sure everyone gets the opportunity to ask a question, but go ahead if someone does have a question, and we'll get started with whomever has a question for either of any of our panelists.
Hi, this is Esteban Hernandez at Denverite. I wanted to ask, with vaccine access, how is the city and Denver Health ensuring that the vaccine is getting into some of the neighborhoods that have been hardest hit with COVID? I've been looking at the maps provided by Denver Public Health, and it looks like some of the wealthier neighborhoods have started receiving the vaccine at higher rates than some of these other underserved neighborhoods.
Bob,
I'll go ahead and respond to that, and perhaps Dr. Judy Schley can jump in as well. So as I said, first of all, thank you for the question. And you know, I think we've demonstrated from the start, even before we had our first case of COVID-19, that our most vulnerable was what we needed to focus on, filling in those gaps with our mobile unit, building out testing locations in our underserved communities. Testing people of color, increase of 40% with that model. And that's the model that we're moving towards. We're still looking at whether or not we can launch a mobile program with vaccine. There are some challenges with that, because once you open up a vial, you either have 5 doses in there, 10 doses, depending upon which manufacturer, which vaccine we're using. And so we want to make sure that we don't waste that. And we recognize, early on that those that have more resources are more likely to get to those places that are stood up easier, hospital systems and the like. But we're going to ensure that we protect our most vulnerable by building out that model that I talked about with dozens and dozens of locations. And then we'll work with our partners to fill in those gaps with other smaller drive-through pods. And I hope that we can build that out in the next couple of weeks. I'm confident that we will be successful with that model.
Bob, if I can add, this is Judy Schley again. We also are working with the city through Denver Public Health, our immunization program, to use outreach teams to highlight groups that we really do need to take care of. And so right now we're starting in the near future to be able to address the Denver Housing Authority senior buildings. And we'll be starting that and working through that. And then in concert with DDPHE, figuring out those groups that we need to, those niche areas that are 70 plus in particular, or certain other groups that we have deemed that need to be vaccinated, and we're going to them for these large events and taking care of them.
Thank you,
Mayor
Dr.
Hancock.
Schley. Do you have anything to add? And I would just ask if everyone can mute their phone or mute their microphone, please, if you're not speaking. Thank you. Mayor, anything to add?
No.
All right, next
Let me
question,
say this,
please.
Teresa, I'm sorry. Actually,
Go ahead. Go
this
ahead,
is,
Mayor.
I don't think this is an indictment on the state, but this is one of the reasons why many of the mayors came together and recognizing that we can be helpful in the distribution of the vaccine and the application of the vaccine. And identifying where some of our most vulnerable residents live and making sure that we have the capacity to get it out to them. And so it underscores the importance of the letter that we are issuing to the Biden administration.
And Mayor, that letter was sent out yesterday, correct? And you were one of the original signers onto that letter. And I think it's important for you to highlight, the other unique needs of some of our residents that we're advocating to bump up on the priority list as well.
I talked about the homeless, for example. We truly believe with the number of our neighbors who are unsheltered, we need to make sure we get them vaccinated, get them into the rotation sooner than later. And then obviously, the historically untrusting communities of color, like the African-American community. We have the ability to, and the relationships to, I think, penetrate that community a little more and a little more effectively. And we think it's important that we're able to get to them and make sure that we have conversations about the lack of trust and get them vaccinated as well.
Mayor, thank you. And if anyone else has another question, go ahead. We'll open it up.
Mayor, this is Vicente Arenas with Fox 31. You mentioned preparing for protest at the beginning of the news conference. Can you give more specifics about how the city's preparing for protests now through Inauguration Day? The ADL has said that it's concerned that extremist groups could show up here around our Capitol and cause serious problems. You mentioned a few things. Can you give more details about and tell the people of Denver what the city will be doing to help keep the city safe during these days? Thank you.
Yeah, Vicente, I think it's important that we not go into the specifics because we are monitoring the intel of these various groups. But let me say this clearly. One, the risks are real, and the threats are real. We've been monitoring them. We're familiar with a lot of the groups and many of the individuals who are, talking about what they plan to do and what they want to do. I do think it's important to reassure the residents that Denver Police Department and our other public safety departments here in the city and the state of Colorado are in direct coordination with the federal authorities to respond appropriately and do everything necessary to keep individuals safe. I will be announcing shortly after we have the ability to notify city employees and all of our independent agencies a modified schedule for our public buildings. It's certainly much easier for us to manage the safety of our city and public employees if they're not in the buildings at the time that we know that the threats are real. So we will be announcing shortly when that occurs. But more importantly, know that we have not only city employees in mind and how we keep them safe, but all of our residents and visitors in Denver at the time that these demonstrations are supposed to take place.
Mayor, thank you. Next question, please.
Mayor
Hi,
Hancock,
this is
Jessica
Jessica
Starr
Hughes.
with.
We'll go ahead and start with
Going back-
Jessica.
Go ahead.
Oh.
Okay. Hi. With Denver wanting to make sure that people experiencing homelessness are prioritized with vaccine distribution, has there been any conversation with the state on whether how that would work with the local government setting their own prioritization with vaccine?
We don't, Jessica, today we do not have the ability to set our own prioritizations. One reason why we are communicating directly to the state our concern and desire to vaccinate our neighbors experiencing homelessness. And we're working with the state right now on that question. And so it's also the underlining motive of why many of us as mayors across the country, because of the unique settings of many of our urban environments and the unique populations that we serve, felt the need to join together and go to the president-elect and say, as you take office, assume the control of this rollout, consider giving direct allocation to city government so that we can participate in helping to make our objectives reality.
Thank you, Jessica. And was that Jaleesa, or I'm not sure who was also trying to ask a question?
Yeah, going back to that letter, there you got the President-elect Biden mentioned some of the advantages of giving some control of the vaccine distribution to cities. But what do you think are the holes in the state and federal rollout?
Well, I'm not sure the infrastructure was in place. So when you read the letter, you'll notice that not only do we ask for direct allocation, but we ask for resources to set up the infrastructure so that Bob and his team could have necessary resources to do a small mass vaccine center, for example, and have the resources to get it done. If they want to go to a neighborhood that is a vulnerable neighborhood, one that does not have grocery stores, because the reality is when you think about how we're distributing this through our grocery stores, we still have food deserts in the city of Denver. When you think about how we distribute through healthcare system, there are still a lot of folks who don't have access to healthcare systems. And so we got to go into those neighborhoods and maybe set up a smaller operation to bring people in to get them vaccinated, or go to even more of our older adult living facilities and make sure they get vaccinated. So I just think that local governments have greater ability, if given the resources to set up the infrastructure, to get in and to know where people are and to make sure we're meeting their needs.
Thanks, Jaleesa. Next question.
Hi, this is Ed Seelover. Oh, yeah. Hi, this is Ed Seelover with the Denver Business Journal. I don't know if this is more of a question for Bob or for the mayor, but Bob, you started to talk about what's got to happen to go into 5-star certification. Can you all talk at all about how many businesses have been pre-certified, and then kind of walk us through again what steps have to occur for these businesses to start going up to greater capacity? Thank you.
Yeah, I will also share that one of my colleagues, Eric Haraga, Director of the Office of Economic Development and Opportunity, is also with us this morning. So if there are questions I can't answer, I know that he can jump in. In terms of businesses that have been pre-certified right now, I don't believe that there have been any. We want to be thoughtful about that process, and I believe everyone knows that the state just approved our application to move forward with that process. So Director Haraga and his team are building out the capacity to do that, working with partners to get auditors in place to do those inspections. Pre-certification can start as soon as the infrastructure is built out to do that, probably still a couple of weeks out on that yet. But again, we can't pre-certify businesses, but they are not allowed to operate in a less restrictive level until we are under that 350 threshold for at least a week. That puts us into the orange level part of the dial. And then after a week in the orange level for those businesses that are pre-certified at that time, then they can move into yellow level restrictions. And if that doesn't answer your question, I know that Director Haraga is happy to jump in.
Yes, Director McDonald, that's precisely correct. So we just got word today of our approval for 5-star, and it's really a contingent approval, contingent of meeting that orange level metric and getting that 2-week cumulative rate to around 350. So we still have some time to go before we could actually certify, but we are creating the infrastructure and the pipeline now. The state requires us to create an administrative committee, which we will assemble the first official meeting next week, and really building through an application process, a training process for on-site inspectors / auditors, all the way through certification, compliance, and reporting. So we still have some work to do, and hopefully we get to that 350 level sooner than later. And we're ramping up now so we could start the process, even pre-certify companies, and then give them the date when they could be opening at less restrictive conditions.
Great. And just one quick follow-up. How do companies get in touch with you to go through the pre-certification process?
We are standing up a website right now. We are working with our partners on this and with the private sector, one of them being our fiscal agent, Visit Denver. We have H2 Manufacturing Solutions. So pretty soon you'll see a portal so businesses can get a hint and a preview to expect what to expect in an application, including checklists and other requirements. So we'll be working on that pretty rapidly now.
This is Vinny Del Giudice at Bloomberg News in Denver. Mayor Hancock, what has been the ebb and flow of the vaccine supply into the city? Have you come up short on any days, and have you been able to get reliable information on what shipments will arrive and when they'll arrive and the amount of vaccine? Thank you.
Yeah, great question. While I missed your name, I think that's a better question for Bob and the governor. In terms, I do know there's been an ebb in terms of the expectation at times. We have more or less vaccines than expected, and then there are times when they open up the facility and find out they have a few more. So it's been a inconsistent supply that's been flowing into the state, which of course impacts the supply coming into the counties and the cities. But it is a good question for the governor. Bob, you may have additional information on that.
Yeah, Mayor, you're absolutely right. There has been some ebb and flow. It hasn't been a consistent supply, somewhat unpredictable. I've heard anecdotally some situations in where providers have run out of doses, or they've had extra doses and they've run out of people that they can vaccinate within their venue if they had an event open or a clinic open. One of the things that I think will help manage that process is that we recently communicated with the state health department that as a city, we would like to manage that allocation. We would like to, as a city, determine what percentage of the available doses go to what venue, whether it's pharmacies or clinics or hospital settings. That, I think, coupled with better communication about how people can sign up, I think will help smooth that out a little bit. And having said that, I want to go back a little bit to something I said earlier about, this department kind of standing in the gap. Accessibility to locations is key, but the other thing that we're very sensitive to is that we don't want a complicated process. We know that many don't have access to or the wherewithal to get online and navigate through patient portals and register. So where we fill in the gap, we want to try to make those drive-through clinics that will be placed in underserved communities as easy as possible for people to drive through, get their vaccine, and get back on home.
Yeah, thank you very much. And I'm sorry, Mayor, this is Vinny Del Giudice at Bloomberg. I'm sorry if my introduction got cut off. One more thing, if I may, on the protests, I know you have to be careful what you say, but do you have any dates in particular that you think you may see activity this weekend, inauguration day, what have you? Thank you again.
No problem, Benny. Actually, it's been publicized in terms of our release, at least revealed by the FBI, that the frame of the concerns are the 16th through the 21st. So it's over those 5-6 days that there's a great deal of concern. And obviously, we'll continue to take precautions even thereafter. But that's the time frame that has been most identified by the FBI.
Hello,
Thanks,
Mayor.
Vinny.
Can you hear me?
Yes.
Mayor, this is Rick Salinger from Channel 4.
Hey, Rick.
I just want to be clear. There was some talk earlier this week in the state's news conference about a mass vaccination site in Denver. From what I understand you were talking about today, it sounds like that is not going to happen. Instead, you're going to direct efforts into multiple community sites. Do I understand you correctly in that regard? And could you explain a little more about that, please?
Yeah, Rick, great question. And so let me clarify. There are a couple of institutions that are planning mass vaccination sites. They're not Denver-run sites, but we have been asked, and we are doing what we can to be assistance to them in setting up those sites. When I spoke about the smaller, maybe neighborhood-focused or area-focused vaccination sites, those would be those sites set up by the city of Denver. We are not at this point as a city planning a mass site. If anything, and Bob McDonald can chime in here, we would look at smaller vaccination sites in areas that maybe are food deserts or where people may have lack of access to healthcare facilities or systems to access the vaccine. But that would be a city-driven effort, whereas the larger mass vaccination sites that the state alluded to are not necessarily initiated by the city of Denver, but would be something that we may aid in the process of allowing or to help happen. Bob, any thoughts?
Yeah, that's right, Mayor. I would only add to that those large vaccination sites, there's no doubt that people will be vaccinated through that process. But we recognize as a city that for our underserved communities, they still have to get there. They still have to be able to get there. They still have to be able to register. And there's some real barriers there for people to be able to do that. So that is not the focus of the city's plan. We certainly want to support those organizations, as the mayor mentioned, but we want to take a more targeted approach, removing those barriers that you sometimes see with those large vaccination drive-throughs.
And Bob, we learned a lot of that. We learned some great lessons during the mass testing site that we set up, and that though it may be inconceivable for some folks that they can't get to, that some people can't get to the testing site, we saw where it was a barrier. And only when we were able to move into communities or areas of town where the most vulnerable were, where we met them where they were, that we see an increase in testing of those populations. Rick, did we answer your question?
Yes, thank you very much.
You bet.
Good question, Rick. Thank you. I know Seth from the Gazette was on the line as well. Seth, did you have a question? I want to make sure we get you in as well.
No, thank you. Everything that I was wondering about got asked by somebody else, so I'm set. Thank you.
Perfect. Anyone else that I missed and earlier who has a question?
I have another question.
I'm sorry, go ahead.
Mayor Jaleesa again with 9 News. Any response to the ethics complaint filed regarding your Thanksgiving travel?
First of all, let me just say I understand that, while people were upset and disappointed in my decision, but while it was an unwise decision, it was not unethical. And I have confidence and trust that the Ethics Committee will see it that way as well. We will certainly cooperate and respond directly to the inquiry. And but I again have trust and confidence that they will find that there was no unethical actions on my behalf during that trip, and it will be dismissed. Excuse me.
Thanks, Mayor. Any other questions from the group? With that, I think we're good to wrap it up. Any final comments, Mayor?
No, thank you all very much, and let's all stay safe and healthy. Thanks, Teresa.
Thank you, everybody.